All right. Hello, everybody, and welcome back to the lab. Hope you guys really enjoyed last week's episode with Drake Berberet from Hawk and Dynamics. Really good stuff. Hope you guys decide to reach out to him and check out his page, Strength to Speed, if you guys want to go look at that. With me today, many of you know him as the Flexing Physio. And now that I just found out, he's also known as Uncle Dan. So, welcome. Welcome.
Thank you. I love the work that you're doing. So it's an honor for me to be here chatting with you today, although we are in completely opposite time zones.
Different hemispheres, different parts of the world.
It's crazy.
So Dan here is in Melbourne, Australia, for those of you who don't know. And when we initially tried to set this whole thing up, we got our times completely crisscrossed. And here we are now. So we're recording. We're going to have some fun today. But the topic for today between Dan and I, and if you've been one of my students over at UD, you've heard this talk before, but just the importance of patient rapport and establishing, I guess, what some of you might have heard is the therapeutic alliance, right? So the bond between PT and patient. So Dan, because you have so graciously come up with this topic for us to discuss today, and you're obviously passionate about it. I mean, especially like looking at what you've done on your page. Why did you want to talk about this today with me? I'm curious.
It's really, that's a really, really good question, man, because I feel like as a physiotherapist, or in America, you guys are called physical therapists, right?
Correct.
Yeah. On a side note, I like the term physical therapy a lot more than physiotherapy. I feel like when people in Australia, some people come to see physio and they almost expect to get a lot of hands-on and like spending most of the clinic time doing hands-on. And when I get them out to do exercise, they're almost a little bit confused. Like, wow, physio exercise, what are you talking about? But in America, being called physical therapy, it's like, we're here to get you physical and rehabilitate you from a physical perspective. So I think Australians, I think we need to change our name. But anyway, that's a bit of a tangent.
Mhm.
Why I like talking about building a good patient rapport is I I truly think as a physiotherapist, having good solid patient rapport can significantly improve patient outcomes. And look, it's not for every single pathology out there, but for a lot of them, I think if you, as the practitioner, if you have a good relationship with your patient, and if they like you and they trust you, I think it significantly improves their um, compliance with their homework when they go home. Because if they only rely on the half an hour or 45 minutes they get during that week to come see you, and that's all they rely on, then that's 1% of their week. So the real work happens when they go home. So if you can get that increased compliance, then surely it will improve patient outcomes, right? And I
Mhm.
also think being a physio is more than just helping someone get stronger or helping them or listening to their problems. Or I think being a physical therapist or physio, it's about being their coach as well. So not so much there to pick up the pieces, but there to help them pick up the pieces, but also to give them the skills that they need in order to reduce the risk of further injury or any future injury. So that all comes down to having a good, solid relationship with your patient. So that's why I feel building good rapport is the foundation of what we do. If you start the consult off on the wrong foot and the patient just doesn't trust what you're saying and you don't have that good relationship, I feel like that's not setting yourself up for failure. That's not the right word, but it's just not very therapeutic and optimal is the way I like to put it.
So that kind of brings me back to like when I was going through my class. So I'm not sure how physical therapy school is all set up down in Australia, but I know like up here in the
Mm,
United States, you have to go through clinical rotations like through your doctorate program now. And
mm.
I still like what you were just talking about. I just had a flashback or like a light bulb memory to when I was in my final rotation. And I remember I'm trying to explain to this kid, like, you lack external rotation. That's why you've had to compensate in your mid back, like yada yada yada.
Yeah.
And I remember my CI just going, "You think he got any of that? Like, do you think he picked up any of that?" I was like, "What do you mean?" Like I explained everything. He goes, "You explained it as if I'm listening to you." But like,
Correct.
that kid just gave you the glazed eye look about 30 seconds into what you were just talking about. And I'm like, oh crap.
Yeah.
So like that was like a light bulb thing for me where like I had all the information correct. I had everything
Mm,
like ready to go, but in layman's terms, not so much. So it's like you can be as smart as possible. You could learn everything there is to know about, rehabilitation, sports performance, strength conditioning, but you have to
Mm,
find that like that even ground, right? And
yeah.
like I actually had a professor when I was at the University of Dayton who would basically tell us like no one cares how much you know, but they care about how much you actually care for them. So like
Yeah.
going back to your point already, like that bond is already really important. Like, it kind of makes you wonder, maybe we should have a few more psychology courses.
Yeah, that's exactly right, and that's what often the comment that I make to,
Mhm,
often the comment that I hear a lot of the older physios saying, and even I would think, but in university, I think they do a really good job with setting you up so that you can learn what you got to learn to get your registration, so you can practice as a physical therapist legally. But I truly believe the real learning comes after you graduate and you start working without having that safety net of your clinical educator to pick up the pieces if you screw up or whatever.
mhm,
And I think most of my communication skills have been picked up after actually learning and after actually working as a new grad physio, where you can't always have the luxury of stepping outside to go chat with your educator, because you are now the physio, you are now the boss, so to speak. So
mhm.
yeah, it's can be very daunting. Hey.
It's definitely not an easy process. I mean, especially for people like I don't know how you are in terms of like in the clinic versus out and about, but like
Mhm.
I'm a very quiet individual, but when I'm in the clinic, I feel like my personality is a complete 180. So I feel like there's also that clinic presence compared to like your social presence, if that makes sense.
Yeah, that's it. I made a reel once, which I think it did pretty well. It was this Indian movie, and Indian movies, they're always super exaggerating of certain scenes. And there's one scene of this guy. He's dressed up as an old woman. This is an action movie, so he must have been some sort of a Mission Impossible moment where he's like riding on the top of a train, and then all of a sudden he rips off his mask, and he's now a he and not a she. And I took that snippet, and then my caption was, when you have to change personalities between patients. And that's just, have
I
you
have,
seen that one?
I have seen that. I know exactly what you're talking about. I remember your real name.
It's so funny because it's so true. You can be seeing an 80-year-old old man that needs a stronger knee so that he can bend down to, do something down there. And then after that, you could be seeing a 10-year-old kid. It's just completely different, right?
Yeah, I mean, relay of information, your energy levels are going to be drastically different. Like
Mm,
we're very drastically, I guess you could say, inclined to like vary how we need to be based on the patient, and like because their ability, like if you're hyped up all the time, maybe you have that one person who gets turned off by that,
yeah.
being able to read them and things like that. But what are some things like so I guess like you were saying, like when you first started getting out of the clinic, what were some things that you had to work
Mm.
through as a clinician? And like what were some things that you kind of took and were like, oh, like this would be great for other people to like learn what to do?
Yeah, I think what you said before is really important, learning how to read your patient. And this comes with a little bit of having EQ skills. So there's IQ and there's EQ, right? And I think
Mhm.
IQ will only get you so far in life, but I think EQ allows you to read people and reading the energy in the room a bit. So something that I had to work through is talking less or being less abrupt with my questions. So, for example, instead of saying to the person as they come in, instead of saying, "Oh, so what brings you in to see me today?" And I'll instead of doing that, I'll say, "Oh, so what brings you in to see me today?" And then I'll sit back and then I'll let them talk. And then I'll just be quiet. I'll zip up my mouth and just let them talk. Because there's some research that shows the average time that it takes for a physio or a practitioner to butt in, I think it's something like 11 seconds or something even less than that. I think like 8 seconds or something, which is crazy,
Yeah. How much information are you going to get from 8 seconds?
right? Probably nothing. They're doing good. That's all, or bad. So that's something I tell a lot of my students is don't be afraid to just sit back, relax, let them do the talking. Because if you give them the space to speak, most of the times they'll just list off their problems for you, and you just need to fill in the gaps after you let them finish speaking. You can fill in the gaps and go from there.
No, that's wonderful. I actually there's another
Mm.
study out there that actually says that like if your subjective is really small,
Mm.
actual accuracy of your objective measures is actually not going to be good. Like you're going to basically throw the gambit of tests at them. You don't know what is pertinent information to them. So,
Mm.
and I also kind of wonder how much of that is taught from like the education side because they want you to like hit through the check boxes of you got to ask these red flag questions. I mean, obviously those are definitely important, but then like you got
Definitely, yeah.
X, Y, and Z information. Uh,
Yeah.
and I definitely feel like sometimes I mean, active listening skills are not exactly always great when we're trying
Mm.
to, go through our clinical rotations because we want to make sure that we're one doing our due diligence in our evaluations and getting
Mm.
the right information out of our objective measures or special tests, whatever have you. But
Yeah.
you can narrow that down so easily just through your subjective questioning. I mean, like you already said, they're going to tell you all that information, right?
Yeah.
So, like when you are going through with your students and you're trying, so like I guess we can kind of switch gears from patients. So, like you obviously do a lot
Mm.
of mentorship with different clinicians.
Mm.
How have you gone about identifying where they lack in their communication skills and then teaching them ways to improve on that?
Mm. Yeah, going back to what you were talking about in the beginning of the potty, about you uh, in your younger years, maybe when you were still a student, feeling like you had to tell the patient everything that you know about Osgood Schlatter's or Singding Larson Johansson syndrome. Like we want to, we often feel the need to have some verbal diarrhea and just tell the patients everything because it makes us seem like we know what we're talking about. So it's more so a bit of confidence for us to be like, hey, to the patient, hey, I know what I'm talking about here. So you should listen to me because I have the tools to help you get better. I think that at the end of the day, it's not about us wanting to be proud or boastful. It's just us wanting to show the patient that, hey, we know what we're talking about. And I feel like often in new grads, we have this you know theorem where we want to we feel the need to we have it to prove ourselves. But after, for me, I've been working now for close to 5 years. Now's the time where I'm like, hey, I don't need to prove myself to my patients anymore because I've been working for a few years. I think patients come in to see me and they already kind of trust what I have to say. So sometimes I see when people are just telling everything that they know to the patient, I afterwards I'll tell them, hey, look, sometimes less is more. Just tell them what they want to know. Tell them, because at the end of the day, you tell them 1,000 things, they'll probably remember 20. So just tell them the most important things. What's gonna
Mhm.
what's gonna help them? What are they dealing with? What's gonna help them? How long is this gonna take roughly? That's what they want to know. They don't care about the pathophysiology of cells and regeneration. They don't really care about that unless they are. Some patients do. So you got to
Mhm.
read the room.
Very true. Very true. I mean, hmm, what would be like your hardest instance, like as a developing clinician, like when you found that one person who was just like, no matter what you did or what you said,
Mm.
try to communicate it. Like, who was like, I guess, give me an example of like your toughest patient that you've had, where like, no matter what way you try to communicate it, you had to find another way.
Oh man, literally 2 days ago.
Okay.
I'm here like rubbing my face because I'm like, oh man, this you just brought back some memories. So 2 days ago, I had this guy come in, and he's one of those people that he's had a surgical intervention done on his knee, and he holds whatever the surgeon says as gospel. So the surgeon in his life is God. And who am I? I'm just a physio. So whatever I say does, if it doesn't align with what the surgeon says, he's immediately putting that into his BS bucket, into his brain. So, and this guy, he came in with a lot of already preconceived ideas that he holds on to so much. So, for example, he comes in and the first thing he tells me is all the supplements he's taking for his knee. And I'm like, that's fantastic. Like all these supplements that you're taking, and so this is my brain thing. I'm thinking all these supplements you're taking, that's great.
Hmm.
However, that doesn't replace the strengthening that you need to do to get this knee capacity to improve. No amount of magnesium can you take to make your quads get stronger, right?
Yeah.
So as he's telling me all this stuff and all these preconceived ideas, inside I'm just thinking, okay, this is going to be a bit of a tough titty. I don't know how to quite navigate this consult. But I think what I did at the end was I listened to whatever he had to say, and I made him feel validated. I did it. I tried my best to not at once uh, tell him that what he's doing is kind of useless. But
Mm.
in a sense, I just kept on giving him positive affirmation, being like, "Oh, that's great. Yeah, tell me more about the supplement," and just saying, "Yeah, good, good, good." And then at the end, that's where I slowly try to interject my ideas about, all right, well, you're taking all that. That's fantastic. So that's going to really help what we're going to do here, which is
Mm.
hopefully get your quads, get your hammies a little bit stronger. And then I think at the end, I won him over. I think I made him laugh a few times because if all else fails, just try to make them laugh. I think that's a
No,
that's a bonus.
that is definitely so. Like, I definitely think we get not to say we get like. And I've met some clinicians who are like, they put themselves on a pedestal, like patients down here, I'm up here kind of a thing.
Yeah,
Like you said, getting them to laugh, like patient buy-in can be literally as easy as just treating them as a human being and like
correct.
finding some form of, it doesn't even have to be medical. It could be some form of relation. Maybe it's a love of something. Like finding
Mm,
some form of buy-in sometimes doesn't have to be physical related. Like
yeah,
I had a guy, like this guy, total knee replacement, hated the world, like absolutely had his other knee done before, so he was already kind of expecting like this is going to be a horrible process again.
yeah.
And like all he saw was my coffee cup that was like, I don't know if you're familiar with the University of Notre Dame. Uh, up here, I didn't think so. That's okay. That's okay. No,
Yeah.
so it was just a University of Notre Dame Cup, and he looked at that, and then all of a sudden he started talking about that. We started relating about
Mm,
the upcoming football season. Next thing you know, we started talking about his knee, and I basically
yep.
had that going with him. We started talking a little bit more. Next thing you know, we're
Yep.
like talking about his physical therapy program, and he
Yep.
left and smiled. So it's like, did we get a whole
Awesome.
lot accomplished in day one aside from just getting a few measures and maybe starting 3 exercises? Yeah, that was it. But he
Yeah.
came in, he had a great session the next 2 weeks.
Correct. Correct. Hey, and on that note, when I was first working as a new grad, I actually had a picture of Nick Kyrgios. Do you know Nick Kyrgios, tennis player?
No, that one's not familiar to me.
Nick, okay, so in Australia, he's known as the Australian bad boy in
Oh,
tennis. Okay. So he's got his fans have quite polarizing views. Some you either love him or you hate him. So I was like, you know what? Personally, I love him. I think he brings a lot of flair and his style of tennis into the sport, which I think is awesome. And I had a picture of him, a big poster of him stuck on my wall. So you see the anatomy pictures is
yeah.
about that size of Nick Kyrgios hitting like a huge forehand. And that often for me, that was the conversation starter. Some older gentleman or lady will come in and look at it and be like, "Oh, you like Nick Curious?" They'll be like, "Well, I hate him," and telling me all about their opinions about why they hate him and how he's a bad boy. Or they'll be like, "Yeah, he's so cool," blah blah blah. And then that is either a way to same with your Notre Dame Cup. It's a way to connect with them as a human, not from a clinician level. And I often tell people try to strip away the layer, not your clothes. Try to strip. Yeah, imagine that. If worst comes to worst, just start stripping, doing a strip tease in front of your patients. That would get you
Sound
sued.
like fun.
But I was saying, try to strip away the clinician layer. You know how
Mm,
there's that white coat syndrome? A lot of people come to physios feeling anxious.
mm,
Their GP has made the referral, or yeah, their doctor's made the referral to come see physio. They
mm.
come in, they're in a clinic setting, and they are anxious, they are scared, and then when they meet you for the first time, they're probably super nervous. So sometimes just talking to them, as you said, like you getting to know a friend, I think that can be really helpful because it takes the pressure off you as the practitioner and them as the patient, essentially.
That's awesome, man. No.
Yeah.
I mean, definitely, I mean, even just conversing with you right now, you definitely have like a good way of like just putting information out there. So I'd be kind of curious to see like, be a fly in the wall when you're a PT doing your thing. That'd be kind of fun to see.
I'm just stripping, man. Woo! Now, oh, and another thing I'd like to add is this is something I've started recently, actually, because how long have you had the lab for?
Over a year now?
Damn, okay, that's
Yeah,
decent, man.
What were you say?
Oh, I was just saying, oh, that's all. I just want to say, well done, man. It's not easy having a physical therapy clinic. It's hard work.
No, no, it's not. I mean, it's fun. I enjoy it, don't get me wrong. I enjoy the company I work for, but there are days when I'm like, what else could I be doing besides PT? And then I remember, no, I actually love my job. I mean, it's given me a lot of opportunities. This
Awesome.
is one of them. So, I mean, I've enjoyed that a lot. Um,
Yeah.
I get to teach in a lot of different settings as well now. So, I mean, it's just, it's kind of like that combination of education and our profession to help people. So it's a wonderful opportunity.
I
But
love that. And is the lab your clinic?
no, actually, this is just the podcast. This is just the podcast. I actually work for Select Medical in the States.
Right. Okay. Because I thought the lab was your physical therapy clinic.
No, this started as just as a passion of mine for strength
Yeah.
conditioning and sports performance. I actually started so like the LAB is actually the initials of my other two co-hosts. So it's Lewis, Alex, and Brandon.
Perfect, man.
Yeah.
Look at you guys. Peas in a
Yeah.
pod.
We're having fun with it, man. It's been good. It's been a lot of fun.
I love that. Yeah. So what I was gonna touch on before was because I've recently opened my own clinic. This is probably 7 months into business clinic ownership, and so in a sense, I can kind of do what I want here because I'm the king of the castle. No one can tell me what to do. And
That's
in the
awesome,
waiting room,
dude. That's
in the
awesome.
waiting room, thanks, man. In the waiting room, I've put a basketball hoop, just a cheap one that I got off, Amazon. I chucked the basketball hoop on the wall so that
Mhm.
instead of going out to the waiting room and being like, "Oh, hello, Mr. Smith, are you ready? Follow me through," and then taking them to the clinic room, I
Mhm.
actually start the consult in the waiting room if it's appropriate. I hand them a little basketball and I say, "Oh, just have a few shots, shoot a few hoops," and they sometimes they look at me in like a really weird way, like, "What the heck? What, like this is a physio clinic. Why am I shooting hoops?" But
Mhm.
very quickly, it gets them to loosen up, and it's almost like coming about this from a way completely left wing perspective and then letting them realize that, hey, we can have fun here. Physical therapy is not just 3 sets of 10 sit to stands. Let's shoot some hoops. Let's play some with some balloons. Let's have some fun. Because I feel like the older adults get, they just stop having fun. They stop playing. And we need to play, man. Play is awesome.
Yes, it is. Oh man. See, you just made my day. You just made my day. No, see, I
Awesome.
love
Glad to
that.
hear that.
I absolutely love that. Like, I definitely feel like we lose that imagination as we get older, and we definitely lose
Yeah.
the ability to like enjoy our physical activity. I think sometimes people see physical activity as just being this chore or torture that they have to go through with in order to
Yep.
like remain healthy and functional. But if you can somehow, I definitely think connecting fun, but then also like taking and connecting like whatever your goal or expectation is for PT, if you can, oh my gosh, if you can connect fun and expectation
Mm.
and goal meeting with that, like you have like the
Yeah.
perfect physical therapist, you have the perfect
Yeah.
program all right there.
Yeah. So true, man. So true. And as I was saying, the older you get, I think people just start having less fun because I don't know, maybe it's like society is telling us to slow down because you're getting old. And I hate it. I think the older you get, the more you need to stay consistent with your strength training. And I have a really strong bias, and I recognize that my whole clinic is set up. So it's like it's I take the patients before they enter my clinic room. So if I turn my laptop around now, I'm
Mhm.
looking at a gym space or a space where there's cable machines, dumbbells, medicine balls. I forcibly take them through the gym space so that when they walk in, they know, oh, this isn't just another one of those massage parlors. I'm here to work. And then I take them into my space here, and
Mhm.
I get to know them and get to understand their problems. And but then I kind of have you seen that movie Focus with Will Smith and Margot Robbie, the magic one?
I don't think I've watched that one yet.
Okay, watch that one. But anyway, there's a scene in there where they try to steal a lot of money, but the way they do that is they plant ideas in people's minds. So that's kind of what I'm doing here. Is I'm planting this idea of we're here to strength train, we're here to get stronger and more robust. We're not here to give you a nice little rubby rub and then send you off your way.
Oh man. That's a brilliant idea though. That is actually like really important. I think you're putting them like the thought bubble already in their head of, hey, we're going to be having fun already, and you've already established that with your environment.
Yeah, yeah.
Expectations are set.
Yeah. Oh, another thing I'd like to add too is this whole idea about building rapport. it's
Mhm.
all well and good, but I completely understand sometimes if you're a new grad and you're working in a clinic that's busy and potentially your appointment times aren't as long. In my own personal experience, my new grad year, I was in a busy private clinic, but I had 1 hour for my initial appointments and 45 minutes for my follow ups, which is a lot of time. And that gave me the luxury to really practice my communication, really spend the extra 10, 15 minutes just shooting, just chewing the fat, as we say here in Australia, chewing the fat with the patients and just getting to know them as a person. And I feel that some clinics, they might do, say, half an hour initials and 20-minute follow ups. In that case, if you're in a clinic like that, it can be very difficult to spend the extra 5, 10 minutes talking about the weather, talking about their favorite sports teams or why they hate Nick Kyrgios. So yeah, it's a tricky situation to navigate, especially as a new grad. It just depends on the type of clinic you're in.
No, I think another how do I put it? Another speed bump. You guys have physical therapy assistants or assistants?
Yeah, we call them allied health assistant, AHA.
Oh, okay, so
Yeah, I
completely
call them slaves. No jokes. And I make them call me general or admiral.
Oh my God.
Joking,
Oh,
joking,
dang
joking.
it. I don't know if I've cried during a podcast yet.
Cry as in happy or sad?
Happy. No, I was just curious. So, I guess another speed bump sometimes people run into is like they don't feel like they should be communicating with that patient when they're in with the assistant because they don't want to take over from the patient session.
Right.
And like, I definitely think that if you did the evaluation, you should be like, when that patient walks in the door, you should be saying hi to them. You should be interacting
Yeah.
with them during their session, even if they're not on your schedule per se. You should
Yeah.
still be interacting with them in that way. Um,
Correct.
I guess since you're in your own clinic, before you were in your own clinic and you're doing your own thing, like how would you have like interacted with it, even if they weren't on your schedule? Like, how did you go about interacting with the patient as well?
Like this for a patient that's not my patient, someone else's.
Yeah.
Yeah, I think that's where it comes down to the clinic culture. It's very important. And
Hmm.
culture in a clinic is, I think, is very important because the patient comes in and they feel the vibes. They feel the energy in the clinic, if you like to call it that. But that's where having make at the moment myself. Um Sometimes I see other people walking, but that's because I'm schizophrenic as well. But no, I'm joking. But what I was gonna say is if you are a physio in the clinic and you see someone that's not your patient, I think totally you should go and say what's up to them. You don't have to start a full conversation and all that. But I think that just creates a friendly environment. And at the end of the day, if a patient's coming to see you guys weekly for therapy, you need to take a part in creating and fostering that good clinic culture, and it comes down to those small things. And also on the topic of small things, um remembering the small things also is very helpful. So if a patient tells you, oh, they're going camping this week, what I'll do is I'll actually write that down on the notes, and it's a bit of a cheat code. But next time you review their notes and you see, I always just say, ask about camping trip. Then next time I see them throughout the consult, I'll be like, "Oh, you said last week you were going camping. How did that go for you?" And you can see them in their brain. They're just like, "Oh, this guy remembers," and I don't remember. I just wrote it down. That's all I did. But I think that's a really easy way to build rapport quick.
Yeah, no, I like that. What other quick little things do you have for building rapport like that? I'm curious.
So that's one of them. That's probably one of the biggest,
Mm.
most underrated techniques out there. Just write stuff down because don't trust your brain. That's my problem, man. The other one, okay, this is a bit of a controversial one. In Australia, especially, I'm not sure what it's like in USA,
Mhm.
but in Australia, I find a little bit of lighter roasting goes a long way. So kind of make fun of them a little bit. Obviously, pick and choose who you do this with, but
Mhm.
especially for the older population who may have every time they go see a doctor or a GP is a very sterile environment. Sometimes just a little bit of light teasing, it just breaks down that clinician barrier and allows them to see you more like one of their mates. So it allows them to be a little bit more honest with you. So yeah, That's probably another one, but be very careful who you roast. You don't want to end up needing to chat to a lawyer or something.
Yeah, a little playful banter never hurt, but I agree with
Yeah,
you. Yeah, I
correct.
mean, pick and choose your person. I mean, don't go for the 93-year-old grandmother who's walking with a stick and you're picking on her. Like,
Yeah, that's a. They'd be like, "Oh my gosh, man, why are you walking like that? My grandma can walk better than you. She's no longer with us. What the heck?"
oh man. So we only have a little bit more time here, Dan. So I just got a few little bit more personal questions.
Sure.
So what got you into being a physical therapist?
So when I was really young,
Hmm.
I was quite chubby, and my mum actually bought me a skipping rope one day, and she said, "Dan, you're too fat. Go skip every night, half an hour." I was like, "Gee, thanks, mum." So I that's how I got into my exercise by force by my mother. And then one day I stumbled into our high school gym, and every day I just started with bicep curls every single day until I trained my biceps so hard that I couldn't physically wash my hair that night. I'd just cramp up. So that was my initial experiences in the gym. And then after doing a bit more research and realizing that there's other muscles in the body, like your back, legs. To be fair, I didn't train leg day until university. But that was what started my passion about exercising and understanding that the body is really super adaptable and robust, and it's not as fragile as some people play it out to be. That's why I really dislike those jelly jam donut analogies for the lumbar spine and the disc. I think we should use more robust analogies like car tires, firmly anchored to your vertebrae. We should be using language like that when discussing this to our patients.
Hmm.
Um, and then I also, growing up, I really enjoyed helping people. And I think it's just instilled into me as a kid my dad will always teach me to help people if you can. So from a young age, I really enjoyed helping people. So I think meshing the two together, helping people and strength training. I feel like you're either a PT or a physical therapist, or you're a osteo or someone in that regard, right? So for me, I chose physiotherapy, and that's kind of how I got into it. Yeah.
That's awesome, man. And you actually bring up a very good point. Uh,
Mm.
verbiage and phrases that PTs and physios will use nowadays. I feel or like phrases that we get kind of hung up on because it's something that we've just heard and we regurgitate like down the line. I feel like the jelly donut one for the annulus and then also the nucleus pulposus. And then like when people are trying to tell you that your hips are out of alignment, right?
Yeah.
Or your knee shouldn't go past your toes when you squat. Like we bring up
Yeah.
these things because it's just terrible for like frame of mind. Like
Mm.
how have you gone about, obviously with your platform and things that you have available to you on social media, how have you gone about
Mm.
like using that to educate clinicians on like your words do carry some weight, like what you say is going to stick. So like if you're
Mm.
putting that fear or like that glass house mentality in them, uh,
Mm.
it's not good. So what have you done in order to kind of help counteract that? Because you're a very
Mm.
strength conditioning forward guy. I love that.
Yeah. Thanks. On my social media, I like to make reels that almost take the piss out of the people that use language like this. Your hips are out of alignment, or your back's out of place, or using these very fear mongering language. And I use my reels as an avenue and as a medium to bring these things to light and just show how ridiculous it is, and how offensive is not the right word, harmful it is for physical therapists to use these words with our patient to either get buy-in to do exercises so your back will stay in place, or to do whatever. So I use my reels a lot, and in my personal day to day, I try my very hardest to avoid using certain languages that I know will or potentially will cause harm to the patient. More out of out of fearful movement if I use certain words with them. So that's kind of how I go about it.
Okay. I've had this before, so I'm curious if you've gotten this. Have you ever had someone bring in something off social media and be like, "Hey, is this true?" Like I know, so
Mm,
I'm not going to shout a particular person here right now, but like someone was like, "Hey, this happened during my deadlift, and now I'm having back pain. Like, is this a terrible thing?"
mm,
So like I started rounding in my deadlift, and now my back's been bothering me a little bit. Like, what do I do? Like, am I really going to have like a bad spine for the rest of my life? Like they say this on
mm,
Instagram. Like, is this true? How have you gone about
Mm.
like combating that otherwise, like in the clinic, not so much through your reels, but like how do you have that conversation in clinic?
Well, I first of all, I grabbed their phone and I smashed it on the ground, and then I spit all over it. No, I'm joking. No, I acknowledge them because the last thing that they want to hear is that they are listening to complete BS. Because a lot of the times these videos that they're talking about and the ones that you're talking about, they're not complete BS, but they're just a very very umbrella approach to a very specific problem, and everyone's back injury or whatever injury is specific to them and their upbringing and their context. So I tell them, look, the video here it's a good video, good advice, but for that person. Now I tell them that you are you, and we need to address your problems according to how you're presenting. So let's take that video and let's just have it in the back of our minds, because we can always come back to that. And look, it might work for you, it might not. So let's get into the assessment. I need to ask you some more questions. Let's get into the assessment and let's try to figure out a more individualized approach for you. And then I look at them and wait for them to comment.
Very nice. Handled perfectly.
Thanks. And then when I turn my head away, I do the biggest eye roll that you've ever seen in the history of eye rolls.
Buy-in, then I express myself. Good.
Correct.
No, but Dan, it looks like we're running short on time here. But no, man, I absolutely loved having you on here on the episode. I hope we get to collaborate a little bit further, hopefully down the line with you and a few other creators that I'm excited to get together and talk about spinal flexion. But we will see.
Oh,
But we're
isn't that
gonna
really bad for your back, spine flexion? I heard
terrible.
that if you do it, your spine will shoot out of your ass.
Like now. No, I'm just
Oh my gosh, yeah. Go pick up your spine, Lou.
kidding. No, but hey guys, I hope you guys enjoyed, the discussion between Dan and I tonight. But if you guys have any questions, please feel free to reach out and then look forward for more episodes. All right. We'll see you guys next time.
Peace.